which is entitled German Aortic Valve Registry, aims to determine which valve disease treatment, TAVI or conventional valve replacement, is best for which patient. Please.
Thank you, Mr. Chairman, ladies and gentlemen. This is the first presentation of the German Aortic Valve Registry, which was intended by both societies, the German Society of Cardiology and Cardiothoracic Surgery. It was funded by both societies and by the German Heart Foundation and by unrestricted grants of industry. The registry is intended to capture both surgical and catheter-based treatment for 5 years and looking at 5 years follow-up to see how each procedure and which valve performs best on the long term for our patients. In the report presented by Professor Hamm today, who is the co-PI of the study, we will report about 15,000 patients who have been included in the time frame from 2011. We are looking at 26,000 patients at the moment who have been agreed to be enrolled in this registry. The registry is on voluntary basis. In 2011, we had 53 cardiac surgery units enrolling and 69 cardiology units, looking at 13,860 patients. You can see and will share with me the outcome of 6,523 conventional surgery AVRs. In addition, 3,462 patients who underwent aortic valve replacement conventionally, including CABG. We will look at transvascular TAVI at 2,694 patients and 1,881 transapical procedures. This is not the complete number of Germany because it's a voluntary basis registry. We have much better inclusion in 2012. Right now, about 88 hospitals have agreed to enroll their patients in the registry. At the end, we estimate by 5 years to look at 80,000 patients, and a 1, 3, and 5 year follow-up is planned, and all the data monitoring is done by an independent institution, the so-called BQS. This slide shows you that the age distribution, that the patients who have been treated by transcatheter means, transvascular and transapical, more or less for those patients who were recommended by the common guidelines of EACTS and EAC. These are to 86, 84% patients older than 75 years. Looking at hospital mortality, and this is what the only thing we will report about at this early stage, you can see that the patients with without CABG, they had, it's not 0.2, it's about 2.1%. I'm sorry about, there's something wrong in this thing. So this is 2.1 for conventional surgery and 4.2 for combined procedures. Transvascular was 5.7 and 8.1% for transapical. It was interesting to note that there was a comparison, and we looked at different scores like the SES score and the Euro score, and this slide shows you the comparison of the Euro score in hospital mortality as predicted by Euro score and the expected one. And you can see that the Euro score in no way is in any way correct in describing the perfect and observed mortality post-conventional surgery, and this is the observed one, 1.3, 3.3 versus 24, 3.8, and this is also true if you look at the Euro score expected versus observed one, 5.5 versus 14.6. So we can say the Euro score is, according to the data as also been shown in previous trials, not the right score to define the outcome. The registry, and this is coming from the German Society Registry, has developed a new score, the so-called AKL score, which also is, I would think, even better, the score to predict the expected and the observed outcome. If you look into the comparison down here, you see the numbers. I'm a little bit concerned how these numbers are. I hope they are correct in your printout, and somehow they are correct in the printout. And I'm sorry that the computer system mixed them up. But if you look into the printout, you will see that the predicted mortalities in the surgical group without CABG and with CABGs are very nicely predicted in the AKL score. There is some difference, though, in the high scores in the TAVI cohort. At that moment, the AKL score may overestimate the observed outcome. Sorry about this technical problem over here. I have seen it downstairs. It was perfect. In conclusion from these results from the registry, we can say that in general, the TAVI procedures have been used the right way and have been used in those patients with high risk. The expected or the observed outcomes compare very well with the current data in the source registry and the partner trial. The early outcome in surgery in general, both for conventional surgery and also for combined coronary bypass surgery as well, excellent. And we have to see the long-term data. We will present one-year results at the ACC next year. Thank you very much.
Okay, thank you.